Welcome you all. Stay healthy, stay blessed. Take good care of yourselves. Today, I will talk about management and homeopathic treatment of frontotemporal dementia. This frontotemporal dementia is certainly a brain disorder, neurological severe disorder. It is mostly caused by progressive loss of nerve cells in the frontal and temporal lobes of the brain. These two regions are responsible for personality, behavior, language, and movement. I have seen several patients, and mostly common symptoms in this disease, frontotemporal dementia, are some behavioral changes we have received: personality and emotional change, apathy or indifference, lack of empathy or concern for others. Repetitive behaviors are also there. Some patients, preferably male patients, express language problems. Some has said difficulty finding the right words, slow or hesitant speech, etc. Sometimes I have seen some symptom, trouble understanding spoken or written language. But less cases, we see some motor symptoms in frontotemporal dementia: muscle stiffness and weakness, tremors, difficulty walking and swallowing, slurred speech. These symptoms are less common symptoms. Now I will talk about the causes. It is indicated that abnormal accumulation of proteins such as tau or TDP43 inside the brain cells are indicated causes. Genetic mutations are also the etiology. Around 30 to 40% of frontotemporal dementia cases runs in the families, what we have observed. One more interesting etiology is damage to neurons in frontal and temporal regions. It leads to brain shrinkage. Now, before going to the treatment part in homeopathy, patient has to continue some management as well. Behavioral therapy works well in this disease. Why? To manage impulsivity and social behavior. Speech and language therapy is also applied, which improves communication, which helps patients maintain independence in conversation. In this disease, occupational therapy also works wonder. It maintains daily living skills such as, I can say, dressing, eating, and maintaining personal hygiene. Sometimes I appreciate patients to continue cognitive stimulation. Patient may continue solving puzzles, memory games, music therapy, or familiar tasks to stimulate cognition. Now, before concluding, I will talk about individualized homeopathic remedies. Indicated remedies for this disease is Calcarea carbonicum and Baryta muriaticum. When indications like mental sluggishness, forgetfulness, and senile dementia in elderly we receive, we prefer to prescribe Baryta muriaticum 10 potency. Regarding this case, higher potencies always works well. Sometimes Calcarea carbonicum moderate potency, 200 or 1 potency, works well when we get symptoms like slow cognitive function, anxiety, fatigue, and loss of memory. From my vast experience, I can tell some more medicines regarding this disease, which are Lycopodium clavatum, moderate potency, when indications are speech difficulties, poor memory, irritability, and digestive weakness is observed. Sometimes Gelsemium sempervirens works well. Moderate potency is applied when we get symptoms like slowness of mind, fatigue, lack of concentration. Finally, I will talk two more medicine names, which are phosphorus and stramonium. Indicated symptoms when it is observed: confusion, emotional outbursts, anxiety, language problems. We prescribe phosphorus. Moderate potency works very good. A couple of months ago, I had managed a case through stramonium. Stramonium 10 potency used when symptoms, indications like aggressiveness, violent or socially inappropriate behaviors were observed. Finally, I can say early intervention may slow symptom progression and improve quality of life. These remedies should always be prescribed by a qualified homeopath after detailed assessment, and always combination with neurological care, always recommended for greater benefit. Thank you.